Hello and welcome back to GP Video Podcast by Nadia. So today the topic that I have chosen to talk about is called, it's actually a question that we will answer through an article, and the question is, can obesity cause back pain? Isn't it an important question? Isn't it a question that we actually see in our real life? So I see a lot of patients who are overweight and who present with lower back pain. So is there any connection between them? Is one causes the other or vice versa? Or does obesity exacerbate the pre-existing lower back pain or back pain? Let's read this article together and find out the answer. Okay, so the name of the article, as I said, is Can Obesity Cause Back Pain? When you have obesity or when you are overweight, excess body weight may put pressure on your spine or alter your posture, making back pain more likely. So because there is excessive body weight, it will put pressure especially on your lower spine, which is thoracolumbar section. Basically lumbosacral. So spine is composed of few parts. Neck region is called cervical. Then the chest region is called thoracic. Then we have got cervical, thoracic, lumbosacral, which is the lower back. So lumbosacral basically is the region which is called the lower back pain. Thoracic is the mid and cervical is the neck. So lower back pain, because your excess body weight puts pressure on the lower back and it can cause lower back pain. And also the article says that it can also cause sciatica and disc degeneration. Carrying excess weight puts a strain on your spine that can affect the discs in between your vertebrae. So what is the spinal column made up of? The spinal column is made up of vertebrae, the bones, and the disc between the vertebrae. Excess weight in the abdomen can affect your posture. Poor posture often contributes to back pain. So number one is that excess body weight puts excess pressure on the lower back. Then excess body weight also causes a poor posture like this, and that can also either cause or exacerbate the back pain. In this article, we will provide information about the connection between obesity and back pain. We will also discuss treatment and strategies you can use to alleviate discomfort. Again, it says understanding the link between back pain and obesity. Not every person with obesity will experience back pain, but these conditions often coincide. Obesity can be a primary cause of back pain, but it can also make an existing condition worse. A large study published in 2017 found that obesity and excess weight are linked to lower back pain and degenerative disc conditions. The researchers found that obesity can be used as a predictor of future problems in the lower back. But the researchers were not able to prove that obesity directly causes back pain. There are a number of theories about why people who have obesity are more likely to experience back pain. These theories include, number one, altered posture. If you have too much weight around your middle or your abdomen, your posture may become altered. Your pelvis and lower back may tilt forward, changing the natural curve of your spine. This change may place excess pressure on the spinal discs and nerves of the back, causing conditions such as spinal compression, disc degeneration, and pinched nerves. So see how beautifully and very simply it has explained that how obesity can affect your spinal column. So how it can affect your vertebral column. So what it does is it basically puts pressure on the spinal discs and then can cause the bulging and then can also cause disc degeneration and also cause the pinched nerves. So the nerves that are coming out of the foramen, they can be pinched, and they can be pinched means they can be compressed, and then that can cause a lot of pain, especially sciatica pain that starts from the lower back and travels along the posterior side of the lower limbs down to the foot. Disc compression, excess weight may increase the pressure on the joints in your spine vertebrae. the bones and the joints between them, the discs between them. Over time, pressure on these joints may cause the cushionary discs between your spinal bones to thin or bulge, leading to chronic pain and pinched nerves. Inflammation. Now, interestingly, obesity is related with chronic inflammation. Obesity is linked to chronic low grade inflammation. It actually causes the inflammatory markers in your body to be high. Whole body inflammation may increase your risk of chronic pain disorders. So this is basically, these are the theories that explain that how obesity can cause or can exacerbate the pre-existing lower back pain. And then in the next podcast, I will also talk about common types of back pain. Of course, lower back pain we have established, but are there any other types, or is the lower back pain also divided in other subtypes? So common types of back pain in people with obesity, and then what can be done about it. Talk to you in the next podcast.